Hi, I'm Andrew Kirkpatrick. I'm an orthopedic hand surgeon with BayCare Clinic, and today we're talking about wrist fractures. Wrist fractures are a very common occurrence, and we see them every day in the hand surgery clinic. Of course, people can break their wrist from any sort of mishap. We tend to see an uptick in wrist fractures when the weather gets cold because people slip and fall on ice. But in the summer, we see a lot of injuries from falling off bicycles and more active type activities. If a person thinks they may have broken their wrist or sustained a wrist fracture, we start by seeing them in the office and examining them and getting x-rays. Then we can know for sure whether or not they've broken their wrist. Far and away, the most common type of wrist fracture is called a distal radius fracture, and it happens near the base of the thumb, where the thumb meets the wrist. Typically, it happens when someone falls onto an outstretched hand. No matter how bad the wrist fracture is, it can be treated. Sometimes they can be treated non-operatively with splints or casts or braces, and sometimes it requires a surgery to fix the broken bone. Recovery time is variable depending on how bad the wrist fracture is or how specifically the wrist fracture has affected somebody. But no matter what, we can get people back to their baseline level of activity after a wrist fracture, no matter what the treatment will entail. Wrist fractures are a time-sensitive thing. If a person thinks they may have broken their wrist, it's important to come in and be evaluated very quickly because the outcomes tend to be better for people whose wrist fractures are treated in a more timely fashion as opposed to people that wait or ignore things.